We are continuing our investigation into the epidemic of prescription painkiller addiction. Ground zero is West Virginia, where doctors write 138 prescriptions for every 100 people. 7 doctors have lost their licenses since January. 15 more are being investigated. One of them sat down to explain his practice to Jim Axelrod.
Doctor, how are you?
Meet Dr. Michael Kostenko. He's written more than 40,000 prescriptions for oxycodone in the last 2 years.
How many patients do you have?
At any given time, we're 800 to 1,000 active patients.
What percentage of your patients get prescriptions for oxycodone?
Nearly 100%.
According to court documents, Dr. Kostenko is one of West Virginia's top 10 prescribers of painkillers.
Did you write 325 prescriptions the first week of January for more than 19,000 oxycodone pills?
Possibly.
You don't know how many prescriptions you wrote?
I don't, it may well be.
Operating at the end of this narrow, unpaved, pothole-filled 2-mile logging road,
You know, sometimes it's just hard to keep your eyes open.
Dr. Kostenko hosts group sessions at his coal country clinic, where, as seen here in videos he posts on YouTube, he explains his approach to treating disease and pain through changes in diet and behavior.
And then bacteria and fungi particles are going to get through into these lymph areas.
After filling out a medical self-assessment, each patient pays $120 cash. As the video shows at the end of each class, they're then handed their prescription for pain meds. There are hardly ever private exams.
There's very little that we need to do in private in our office.
You don't need to conduct a conversation confidential about my use of pain medication? That wouldn't occur in private?
Everyone's on the same pain medication.
In the last 2 years, 3 of Dr. Kostenko's patients have died after overdosing on a cocktail of pills, including oxycodone prescribed by Kostenko, along with pills prescribed by other physicians.
Are you in contact with their primary care physicians to coordinate care?
No.
Don't you have an obligation to talk to the other doctors to make sure that cocktail isn't fatal?
If the conversation would be productive, absolutely.
Well, the patient's dead, so how could the conversation be any less productive than what happened?
There should be better communication between all physicians dealing with these drugs. There just is not.
The state has suspended Dr. Kostenko's license while they investigate the deaths and decide whether to revoke his license. Robert Knittel is the Board of Medicine's executive director.
Is it hard to get a doctor's license revoked or suspended in West Virginia?
It's somewhat difficult, yes. With prescription drugs, physicians can prescribe them. They're legal. It's not like cocaine or heroin.
Did she get 8 prescriptions?
Dr. Kostenko didn't seem to help his case when discussing one of those deaths with us, a woman being medicated by another physician, a doctor who Kostenko never consulted with.
Do you bear any responsibility for that death?
Yes, I do.
As he explains it, Dr. Kostenko wishes the hospital where his patient was being treated had reached out to him. He tells us he didn't know how bad her condition was. New investigations have been opened into the overdose deaths of 2 other patients of Dr. Kostenko.
Remarkable interview. Jim Axelrod with the story tonight. Jim, thank you.